Hello, this is Dr. James Camp from Lee College in Baytown, Texas, and this is the Endocrine System Part C, the adrenal glands. The adrenal glands are two roughly pyramid-shaped glands sitting on top of the kidneys, hence the name adrenal above the kidneys. Like many other organs we've studied in A&P2, these organs consist of a fibrous capsule layer, a cortex layer, and a medulla layer. Unlike most of the organs we've studied in A&P2, however, the cortex and the medulla function almost as separate organs, as almost entirely separate organs. They're both endocrine glands, but that's really the only thing they have in common. The adrenal cortex is the peripherally located part, of course, as the cortex always is, and makes up 80 to 90% of the total weight of the gland. So most of the hormones coming out of the adrenal gland you could expect to be cortical hormones. The cortex is subdivided into three zones that we'll see in detail on the next slide, and each zone secretes a different group of steroid hormones. Steroid hormones, as you know, are made from the cholesterol molecule and are therefore fat-soluble molecules. Those include the mineralocorticoids, the glucocorticoids, and the gonadocorticoids. The hormones produced here collectively are known as corticosteroids because they are steroid hormones that come from the adrenal cortex. As we just mentioned, the adrenal cortex has three zones. Microscopically, you can see that the outermost zone has this kind of glommed together cell structure, just sort of a typical endocrine jumble of cells, and that is called the zona glomerulosa. I think of it as the glommed together part of the cortex. The next layer down is made of these bundles, these vertically oriented bundles of cells that you can see a lot better on a microscope than you can on this image here. And that, you'll recall that the Latin for a bundle is a fascicle, so this is the zona fasciculata. And then finally, the third layer of the adrenal cortex is made of these cells that kind of arrange themselves roughly into crisscross shapes. Still, back in some ways it's back to that old endocrine jumble, but a little more structured than the zona glomerulosa. And you'll recall that the name for a crisscross pattern is reticulated. So this is the zona reticularis. And then below the zona reticularis is a tissue of an entirely different type, the adrenal medulla, which you can see has more of a nervous tissue look to it than an endocrine tissue look. And we'll get to why that is in a minute. The zona glomerulosa synthesizes the mineralocorticoid hormones such as aldosterone. And as you recall from our chapter on the kidney, the main effect of aldosterone is to increase sodium in the blood and decrease potassium. The zona fasciculata secretes the glucocorticoid hormones, such as cortisol. Cortisol is your body's long-term stress hormone, and it acts to mobilize fuel reserves, such as synthesizing new glucose in the liver, breaking down protein in muscles, and breaking down fat in adipose tissues to free up fuel. It also has significantly several anti-inflammatory effects, and so cortisol analogs such as hydrocortisone or prednisone or dexamethasone are used as powerful anti-inflammatory drugs in the clinic. Finally, the zona reticularis synthesizes gonadocorticoid hormones, most of which fall in the category of what we would call weak androgen hormones. The name androgen indicates masculinizing, andro, male, androgen. But really DHEA and similar hormones are a little more complicated than that. They play a role in initiating some of the things we associate with puberty, such as axillary and pubic hair. It plays a role in some of the things that testosterone does in males, DHEA does in females. But DHEA also has some estrogen-like effects, so it's not entirely what we would call an androgen, but that's what it is officially known as, is an androgen hormone. Now we turn our attention to the adrenal medulla. The medulla is quite different from the adrenal cortex, where the adrenal cortex is clearly made of glandular tissue and behaves very much like all of our other endocrine glands. The adrenal medulla is actually made of nervous tissue. It develops from the same embryonic tissue as the sympathetic nervous system, and the release of its hormones is triggered by not by changes in the blood or by by the actions of tropic hormones, but by preganglionic neurons themselves. To put that another way, if you look at the autonomic nervous system, if you recall how it works, it has a series of short preganglionic neurons, which then connect to longer postganglionic neurons, each of which goes to a different target organ and releases a neurotransmitter to that target organ to tell it what to do. The adrenal medulla acts as one giant postganglionic neuron that, in response to a preganglionic stimulation, it's going to release its hormones, which are actually the neurotransmitters epinephrine and norepinephrine, and those are going to be released into the blood to travel all over the body and reach lots of different target organs. Because they'll travel all over the body, this expands the sympathetic fight or flight response, and because they're released into the blood and will stay there for some amount of time, it also prolongs the sympathetic response. So whereas the nervous part of the sympathetic response can last for seconds to minutes, an epinephrine dumped into the blood by the adrenal medulla can expand the sympathetic fight or flight response to a period of minutes to hours. One last note, epinephrine is also known by another name because it comes from the adrenal gland. Epinephrine is actually the same thing as what you would commonly hear called adrenaline from the adrenal gland. Okay, so people, while the medical community is largely settled on using the name epinephrine, everyone else in the world still talks about getting an adrenaline rush, not an epinephrine rush. So those are actually the same thing. Okay, so what does the adrenal gland look like in context, in the microscope here? So first off, you'll see a dense fibrous capsule out at the edge. Then you'll see the glomerulosa cells all kind of glommed up together here. Then you'll see these stacks of cells in the zona fasciculata, and then those cells start kind of crisscrossing each other and jumbling together again down here in the zona reticularis. And then there will be a very subtle divide here, and suddenly you'll see a very different tissue type altogether with some of the kind of, similar kind of satellite cells and axons that you saw in the posterior pituitary and that is the adrenal medulla. Okay, so what hormones come from the adrenal gland? The medulla, as we just mentioned, secretes epinephrine, also known as adrenaline, and its function, as we've mentioned, is to prolong and expand the fight or flight responses. So it's your short-term stress hormone. Cortisol comes from the zona fasciculata, and its function is to resist long-term stress. Finally, aldosterone comes from the zona glomerulosa, and its function, as we mentioned before, is to increase sodium and therefore increase blood pressure, and to decrease potassium in the blood. All right, let's look at these hormones one at a time. Aldosterone. There are three possible stimuli for aldosterone. The one we've learned about so far as part of the renin-angiotensin-aldosterone system is the presence of angiotensin II in the blood. Angiotensin in that case is acting as a tropic hormone. But there are other stimuli. An increase in blood potassium acts as a direct stimulus for aldosterone. And there's a very weak effect, but it does happen, that the hormone ACTH, the tropic hormone that is most commonly associated with cortisol, will also cause the adrenal cortex to release small amounts of aldosterone, which causes your blood pressure to go up during periods of long-term stress. This makes the pattern for this hormone kind of hard to say. It is in the angiotensin II and ACTH cases, the pattern is clearly a hormone cascade type of response. But in dealing with blood potassium, it also sometimes acts as simply a negative feedback loop. That when blood potassium increases, aldosterone comes out, causes the kidneys to secrete more potassium. Potassium goes down and aldosterone goes away. So a very simple negative feedback loop. Okay, what are the targets of this hormone? That's fairly simple. The targets here are the distal convoluted tubule and collecting duct of the kidney. And it activates the same sodium-potassium pump that we learned about in the nervous system in ANP1, that it causes 3 sodium to enter the blood and 2 potassium to exit the blood into the urine. So it ultimately elevates blood potassium, elevates blood sodium and decreases blood potassium. And the net effect of that on the body is to increase your blood pressure. How about the hormone cortisol? The stimulus for cortisol is very simple. The tropic hormone ACTH, also known as corticotropin, is the only thing that the adrenal cortex pays attention to cause it to release cortisol, which makes the pattern very clearly a cascade type pattern. Where cortisol gets complicated is in trying to define its targets and effects. So several organs, but mainly the liver, respond to cortisol by doing something called gluconeogenesis. If we break that word down, we're talking about the genesis, or formation, making, production of new glucose. We're producing new glucose. So the liver, instead of releasing glucose from glycogen, which we presume it has tried to do already and perhaps has run out of its glycogen stores, the liver will shift instead to making new glucose from scratch, as it were, from other raw materials. Muscles will respond to cortisol by breaking down protein for fuel. Adipose tissues will respond to cortisol by breaking down fat. Now, you might say, oh, that's good. I should be under stress more often. I'll lose weight. But the breaking down fat and the breaking down protein happen kind of together. So you'll lose fat, but you'll also actually lose muscle at the same time. So it's not necessarily the healthiest way to lose weight. And then finally, the immune tissues will reduce inflammation, but they will also reduce other responsivities as well. Helper T cells are downregulated by cortisol. So your overall immune response will be dampened in times of long-term stress. Now you may wonder why cortisol, which is doing all of these things to help you resist stress, would then reduce your immune activity. And the closest thing the best explanation I can come up with is that cortisol recognizes, or the body recognizes, that by the time cortisol has arrived, you've been under stress for a while. You're, let's say it's a real physical stress. You're trying to survive in the wilderness or something. The last thing you need at this point is for that scratch on your leg to swell up with an inflammation. Okay, so the cortisol tells your immune system basically to cool it for a little while and overlook that wound in your leg and the small infection that's starting in it, and take care of those later when the stress is over. That works for cases where you're under stress for a few days, but in modern life, where we're sometimes under stress for weeks or even months at a time, it can really lead a person to be quite worn down and to succumb to diseases that they wouldn't ordinarily succumb to really be knocked out, for example, by a case of the flu that would normally not hurt them that much. Okay, and finally, epinephrine. The stimulus for this, as we mentioned before, is sympathetic nervous system stimulation. So when the sympathetic nervous system is activated, there are two ways for the body to activate the sympathetic nervous system. One is to activate it sort of one nerve at a time. To say we want to speed up the heart a little bit, we want to dilate the eyes a little bit, that sort of thing. The other is for a system-wide sympathetic response. And when a sympathetic, system-wide sympathetic response is activated, say we're running for our life in the woods now, there's a bear chasing us or something, we want all systems to come online. And so the adrenal medulla, in that case, would be stimulated by, the hypothalamus would decide this is a real acute stress situation. It would activate the entire sympathetic nervous system, and as a result, the adrenal medulla would be stimulated to release epinephrine into the bloodstream. Targets are most organs in the body. and the effect are those fight or flight type responses. See the sympathetic nervous system chapter in your A&P textbook for a full listing of what those are, but some examples obviously are hormone or heart rate increases, blood pressure increases, dilation of constriction of blood vessels to non-essential organs, and dilation of blood vessels to essential ones, dilation of airways, all sorts of responses all over the body. And the pattern here is one we haven't seen before. This is a pattern we would call neuroendocrine, one where the nervous system is playing the chief role and the endocrine system is simply serving as kind of a slave. All right, that concludes our lecture on the adrenal glands. Stay tuned for one last lecture on the pancreas.